Go ahead.
Yeah, good afternoon, everyone. I'm Dr. Poornima Mathur, from Oasis Fertility, Vadodara. In our previous talks, we've talked about what are the various factors that are affecting your fertility. How does age, how does obesity, endometriosis, how do they affect? Today, we are going to talk about evaluating infertility. So now that you know what are the factors that are going to affect your fertility potential, like when do you go for an infertility evaluation? What do you expect out of it? And whom do you go to? So what is an infertility evaluation basically? It includes certain examination and tests which are done on the couple so that we can determine what are the cause. What is the cause that the couple has not conceived till yet? So, and when do we get an infertility evaluation? When should you consider going to the doctor? So, if you had 1 year of regular sexual intercourse without using any contraception, it's time to see your fertility consultant. If you are older than 35 years of age, the evaluation is recommended after 6 months of active trying for conception. And if in case you happen to be more than 40 years, we would recommend that you consult your fertility consultant as soon as possible so that you can have a smoother journey trying to conceive during that course. So if you've decided that you need to see a fertility consultant, like where do I go to? Who should be my first point of contact? So generally for women, your gynecologist will do your first assessment. If you have access, it is better you see a fertility specialist or your obstetrician and gynecologist would guide you and do your preliminary investigations and refer you to the fertility specialist. For men, it is better if you see an andrologist. If andrologist is not available, a urologist would be in a better position to examine you and guide you regarding further treatment. So हमें पता है like okay, this is where we need to go and see a doctor. This is where मुझे अपने आप को evaluate कराना है for infertility. But what are the causes of infertility? So there are many causes जो हमें female infertility cause करते हैं. There are causes of infertility in females and males. The entire burden of infertility is not on females alone. The couple is in it equally. Now, females में the most common cause of infertility is the ovulatory function disorders. That is, ovaries जो है they are not able to make eggs properly. उसमें अगर regularly eggs नहीं form होता तो you have difficulty conceiving. Apart from that, there are other causes as well. Your tubes are damaged, the fallopian tubes, which are the meeting point where the sperm of the partner and the egg need to form the baby. If there is any tubal damage or blockage, the couple would have difficulty conceiving. Other causes like endometriosis or any congenital malformation in the uterus, any hormonal disturbances, they all lead to infertility in females. At times, we are not able to determine the cause, and it is known as unexplained infertility. It doesn't mean that the cause is not determined, so we don't have a treatment. We have a treatment for unexplained infertility as well. Now, what about males? Now, अगर जो couples हमारे पास report to the fertility clinic with infertility, 40 to 50% लोगों में there is a male factor in infertility. That is the male partner की वजह से there is a problem in conceiving. So the cause can be different reasons. या sperm count is low, या हमारा production ठीक नहीं हो रहा है, or the sperm function is compromised. Motility में problem है, their shape is not good, or there is some blockage in the tubes which are supposed to deliver these sperms, or there can be certain performance disorders, like there is erectile dysfunction or certain ejaculatory disorders. These are the various causes which lead to infertility. We've discussed this pehle bhi, how does age affect fertility, but to re-emphasize it, fertility starts to decline by after the age of 30, more so after the age of 35. By the age of 40, अगर हम बोलेंगे, the chances of a woman getting pregnant is only 5% in a cycle. For males, the age limit is a little different. Their fertility starts reducing around the age of 40 to 45 years, where the sperm quality starts decreasing or deteriorating. The most common thing now, can your lifestyle affect fertility? So if I make any changes in my lifestyle, does it going to improve my chance of pregnancy or not? So lifestyle में the various radiation exposures that we have owing to our cell phone usage, mobile towers, Wi-Fi's, or exposure to pollution, or at times हमारे workplace में we exposed to certain chemicals, or the pesticides that are commonly used in the food that we eat. If we are using any recreational drugs, smoking or drinking, unhealthy lifestyle, that is sedentary lifestyle leading to nutritional deficiency or obesity or eating disorders, the most common pandemic of stress, or we have a disturbed circadian rhythm. Aajkal we've seen, like, owing to our work culture, we've seen we work overnight, we work till 3 or 4 in the night, and we get up at 11 in the morning. Now, when your circadian rhythm gets disturbed, it does affect your chances of conceiving. So, if you are planning pregnancy, it's time to adopt a healthy lifestyle, eating healthy food, exercising regularly, reduce stress by doing yoga or meditation, having a proper sleep pattern, a regular healthy lifestyle. So, lifestyle does affect your fertility, and it's better. The first step would be to adopt a healthy lifestyle. So, how can health conditions affect fertility? This is a very commonly asked question. Like, if I have any other medical comorbidity, is it going to affect my chances of conceiving? So, yes, there can be your hormonal imbalances, or if you have certain infections or endometriosis, which is a gynecological disorder, ये सब affect कर सकते हैं आपके fertility potential को. The various hormones जो आपके अंदर के hormonal milieu को regulate करते हैं, which regulate your fertility, उनमें से एक है हमारा thyroid gland. Now, thyroid gland, like, I'll just give you a gist. How does thyroid affect? Now, thyroid is very common in females. Now, thyroid आपके egg को form होने नहीं देता. It causes ovulation disorder. Time पे egg form नहीं होते. You have irregular cycles. अगर आपका thyroid controlled नहीं है, you have irregular cycles. You have difficulty in conceiving. And at times, if you conceive, thyroid अगर आपका normal नहीं है, if you're not taking अपनी thyroid medications properly, it is dysregulated, you are at a higher chance of abortion or miscarriage. Males maybe similarly, the hormones like thyroid and prolactin, they can affect their fertility potential, their sperm parameters. So general health condition, people usually women come to us saying कि मैम मुझे thyroid की medicine है, on medicine I got my thyroid levels tested which were normal, so I have stopped taking medicine. So once you've been diagnosed with hypothyroidism and आपको medicines पे start किया है, so please I would say do not discontinue any medicine without taking your physician's or your doctor's advice. Okay. So one of the common questions that I asked is, ma'am, you've told हमारा सबसे common cause है ovulation का, and I want to get pregnant. I'm following the fertile period cycle. So can I know whether मेरा egg बन के ovulate हो रहा है कि नहीं हो रहा है? Is my egg releasing or not? So there are measures जिससे आप घर पे you can find out कि whether आपका egg ovulate आप ovulate हो रहे हो कि नहीं हो रहे हो, egg release हो रहा है कि नहीं हो रहा. One basic is आपका basal body temperature track करना. Like first thing in the morning, you check your body temperature regularly. So in the time of ovulation, आप notice करोगे your body temperature rises. So that is when you know कि this is the time where you are ovulating and आपके chances of getting pregnant or conceiving are higher. But इसमें you have to maintain a chart for 2 to 3 menstrual cycle so that you can know what is your normal basal body temperature and this is the rise in your body temperature. The easier way out is a urinary LH kit. Now LH is the hormone जिसका surge or rise होता है just preceding the ovulation. So अगर हम वो LH rise document कर सकते हैं, detect कर सकते हैं, you know you are going to ovulate. So if you do, it is a very simple urine test जैसे एक pregnancy test होता है. You do that test, and if that test turns out to be positive, that is, you find 2 lines over there, it means कि your ovulation is going to happen in the next 1 to 2 days, and you are at your highest fertility potential in that cycle. So इस समय, if you and your partner have unprotected intercourse, the chances of you getting pregnant are high. Though the confirmatory test would be by an ultrasound done by your doctor who can document the rupture of the follicle. But these are the tests that can help you घर पे ovulation detect करने में so that you can time your cycle for conceiving. All said and done, now that you've decided कि मुझे gynaec को visit करना है for your fertility evaluation, what do you expect? I know there's a lot of anxiety associated with a gynaec or a fertility doctor visit. So what do you expect out of your first visit? What would be done over there? So the first visit may usually a fertility specialist would get into a detailed medical history and physical examination. Medical history as in sense since how long you've been married, since how long you've been planning to get pregnant. Have you ever used any contraception? कि आपने कोई contraception कभी use किया है कि नहीं किया है? What is your menstrual cycle? Is it regular? Do you have a normal bleeding between between the medical disorders or comorbidities that you have, any medicines जो आप उस चीज के लिए ले रहे हो, या any ayurvedic, homeopathic or herbal supplementations that you are taking. Past में अगर you've had a previous infection or history of any other medical disorder like tuberculosis or any major surgery in your past, that is important, that needs to be documented. Any family history of a major illness or any birth defects or any previous pregnancy outcomes that you had. So the doctor would get into a very detailed and thorough history so that we can jot down the positive points out of it and help you conceive better. Now, you would be asked about any drug use that you do, any tobacco, alcohol, recreational drugs. Now, you and your partner would also be inquired about how is your sexual life? Like, what is the frequency? Do you experience any pain during the sexual act or any other problems that you face? Any other birth control methods that you used pehle, or any past, like any outcome from your previous marriage or something like that. So once the history is done, we would like to go for a more physical examination. Examine you physically for any infections, any major mass, your thyroids, your breast examination, your abdomen, and your local gynec examination. After a thorough physical examination, we would like to go ahead with certain tests. Now, tests would include either lab test or imaging test. Now, the lab test would include certain blood tests where we can determine आपके routine hormone levels कैसे हैं, your complete blood picture count कैसे है, what is the or AMH, which is a marker of your ovarian reserve, and other things. Now, imaging would include ultrasounds and all. Now, I'll get into detail. And apart from females, men would also be tested. Now, men analysis, for men evaluation, a basic semen analysis, that is उनके semen की जो testing है, that gives us an entire picture as to what is his fertility potential. Depending upon, like in semen analysis, we would get to know उनकी volume कैसी है, what is the sperm count, what is the concentration, how is that particular sperm, like what is the shape, what is the motility, what is the quality. Once we've had a semen analysis, depending upon what does the semen analysis report suggest, your andrologist might suggest to you certain blood tests for your hormone evaluation. If everything is fine, we can actually proceed further with further evaluation. Now, any hormonal imbalance like thyroid, prolactin, or your reproductive hormones like estradiol, testosterone, they can affect your sperm parameters, which need to be evaluated by the andrologist. If there's any problem detected, apart from a like semen analysis, your andrologist might go ahead and conduct a detailed physical examination and ultrasound examination when and where required. For women, we've told the lab test would include basic complete blood picture, your thyroid function test, your prolactins, your ovarian reserve, and apart from that, the imaging test. Now, imaging the most commonly done is a transvaginal ultrasound or a basic ultrasound examination. Now, the first question is, ma'am, you've mentioned thyroid so many times. Why is the thyroid function test so important? Now, we've covered it pehle bhi. Now, thyroid function test, if it is altered, if the thyroid levels are by either it is low or if they are high, they're going to cause difficulty in ovulation in females and difficulty in conception. In males also, if the thyroid levels are reduced, it may lead to reduction in the sperm volume. The motility might be reduced. There might be sperm defects. The libido, that is the desire to have sexual act, might be reduced, and the person might have problems sustaining an erection. And it leads to lowered male fertility hormones like testosterone, LH, and FSH. Therefore, thyroid is a very key hormone in managing and regulating your fertility. Now, let's get acquainted with the ultrasound, which is the basic preliminary test that is conducted in infertility evaluation. Now, your doctor would like to go ahead with a transvaginal ultrasound. Transvaginal ultrasounds are best done even during your periods, on the second day of your periods, where we put in a probe into the vagina, and trust me, it's not painful. You might feel a little awkward about it, but it is very painless. This gives a very clear idea about your uterus, your ovary, the adnexa, and the surrounding structures regarding any infection, inflammation, or adhesions that are there. They gives us an idea about the size of the uterus, any pathology that is there, any fibroid or polyp that is there. The ovarian reserve, that is the number of antral follicles that can be seen in the ovary. Like you can see in the picture, there is in the PIP there is an ovary with lots of follicles. Now, apart from that, one further evaluation can be a saline infusion sonography or sonohysterography and a hysterosalpingography. Now we know, apart from the ovulatory disorders, there is a tubal factor and the endometrial uterine factors. Now, saline infusion sonography we instill saline into your uterine cavity and we capture the image sonographically. Now, SIS or sonohysterography gives us a clear outline of the endometrial pathology. If there is any polyp or fibroid indenting the cavity, that can be easily visualized on sonohysterography. Now, hysterosalpingography, this procedure uses X-ray to determine the patency of the fallopian tubes. Now, how does HSG work? That is done. A dye is injected through the cervix into the uterine cavity. Now, if the tubes are patent, the dye proceeds further into the tubes and then it spills freely into the peritoneal cavity. Now, this spillage and this passage of dye through the tubes can be documented by an X-ray. Now, on the right side, you can see the image, final image of an HSG, where the cavity, uterine cavity has been outlined, the tubes are outlined, and spill of the dye can be documented, indicating that the tubes are patent and we can move a step further in evaluation or starting the treatment of the patient. Now, other procedures that might be required are hysteroscopy. Now, what is hysteroscopy? Hysteroscopy is basically putting in a camera into the uterine cavity and visualizing the endometrial cavity. Now, this is not done on a routine basis in every patient. This would be very individualized, which your gynec or infertility specialist would tell you whether you require or not. Now, this you can see, this gives us a direct view of the endometrial cavity. What is, if there is any polyp, if there is any fibroid, septum, adhesions. Now, this hysteroscopy can be done on office, like on an OPD basis as an office hysteroscopy, or it can be done as in OT with an option of therapeutic approach. Now, if in case we go proceed with a diagnostic hysteroscopy and find a pathology in the cavity, we can go ahead and correct it in the same sitting if we have in the OT. So hysteroscopy can be both diagnostic and therapeutic. If we see a polyp or adhesions or a fibroid or a septum, they can be resected and treated hysteroscopically. Another such procedure that is used is laparoscopy. Now, laparoscopy involves, we use a camera to get into the abdominal cavity and directly visualize the uterus, tubes, and the ovaries. Now, when is laparoscopy done? Now, we have said, like we've done tubal evaluation using HSG, that is hysterosalpingography, and saline infusion sonography. A laparoscopy is where you can directly see it in front of your eyes. How are the uterus? How are the tubes? How are the ovaries? Whether the tubes are patent or not, and if they are not patent, are they diseased? Do they need any intervention? So this laparoscopy can be again both diagnostic and therapeutic. When you want to only determine, see the tubal status, see the cavity, the abdominal cavity for any adhesions or infection, you can go and put in a scope and see and determine. If in case you find any pathology and needs correction, we can go ahead with the therapeutic laparoscopy where we can operate and correct the abnormality. If there are adhesions, if there is endometriosis, if the tube is kinked, we need tubal cannulation, everything can be done laparoscopically. So hysteroscopy and laparoscopy, they have a diagnostic and therapeutic approach which your fertility consultant can guide you better regarding the need in your individual case. So now you decide, now you would be like, how long will this testing take? Like usually an infertility evaluation would be wrapped up in a month or two. You come to us, we evaluate, we get the hormonal evaluation, tubal patency test done. And once we have all the reports done, we can formulate your treatment plan according to it. Now, however, depending on any positive findings in any of the tests, it may take longer in certain cases, though it still varies according to who. Now, the major concern that we have is infertility testing covered by insurance? Now, most insurance companies do not cover fertility, but certain insurance companies may cover, which depends upon the firm that you are working with. So it is always better you call up your firm and your insurance company to confirm, and then you can start with the evaluation or treatment depending upon whether you want to take the insurance or not. I hope I was able to answer the common FAQs regarding infertility evaluation. If you have any queries, please let me know. How do you evaluate infertility? We've just finished the entire on this only. Like when you go to your fertility consultant, they would get into a detailed history and medical examination and conduct certain tests depending upon what problems or what history you've given, and then we evaluate infertility. We've just covered what happens during a fertility evaluation. I know it is okay to be anxious regarding your first visit to a fertility consultant, but it is usually smooth. People walk in anxious, but they leave very much relieved once you've undergone the entire physical examination and medical history. When you know that you would be able to figure out what's wrong and what is the cause for you facing troubles during fertility, you get very much relaxed. So when you walk down to a fertility clinic, you're expecting a detailed history and physical examination with an ultrasound and a few blood tests. The various causes of infertility, just when a couple, like we would say both male and female go hand in hand when we're talking about infertility. The most common causes being the ovulatory disorders or tubal factors or associated pathologies or anomalies in the uterus or the male factor. The most common fertility problems are usually difficulty in conceiving. People might have irregular cycles, delayed cycles. For men, they might have difficulty ejaculating or they might have erectile dysfunctions. How do you prepare for a fertility consultation? Yeah, this is a very nice question. Like, if you are planning to go visit a fertility consultant for your evaluation, the first thing is you and your husband need to be very sure that you are not supposed to keep any history from your doctor. You need to tell them everything that has happened, any treatment that you've ever undergone, any surgeries that you had in the past, and preferably you should carry all your previous medical records when you walk into that room. It is always better if you come to on second day of your periods where we can go ahead with a detailed evaluation. If not, and it is always better if you come as a couple. It is always advisable that you consult as a couple so that both of you are on the same page regarding how to proceed with the treatment. Hi ma'am, this is Sindhu. On 22nd June, blastocyst transfer done today is 13 day. Can I confirm it's 22nd June? I am you. Hi Sindhu. I understand you had embryo transfer on 22nd of June, and after that, today is 13th day of your periods, and you've tested for urinary LH. If I'm not wrong, this is what you're asking. If it is, see, if your blastocyst transfer was on 22nd in June, which was negative in that case, and I'm assuming it is your 13th day of period. If your urine rapid test for urinary LH is negative, you can actually do a repeat test. If you want to confirm it, you can get a serum LH level done or get an ultrasound done. A serum LH would guide you as to whether your ovulation is likely or not. If you undergo an ultrasound, we can actually see whether there is a dominant follicle ready for rupture or not. So it's better you go to the doctor, get an ultrasound done, and if she feels the need, she can advise you serum LH so as to decide whether you're ovulating or not. Okay, I guess I've answered any queries. If you have any queries, feel free to contact Oasis Fertility Helpline. At Oasis, we are more than happy to help you with your fertility evaluation and helping you achieve your pregnancy. Thank you so much.